Welcome. My name is Dr. Ernesto Medina, founder of For Healing Health and Wellness Center in Round Rock, Texas. Thanks for joining. This webinar will be recorded, so if you do get disconnected or occupied, I should have this posted on my website, which is listed there at the bottom, forhealinghealth.com. By the end of this week, maybe even by tomorrow, where you can review the webinar on your own. All right, so we're talking about female hormone health. This is a very potentially controversial topic, very confusing topic. It's something that I teach on because over the years, I've seen many women come in with hormone irregularities, PMS, infertility, PCOS, which is polycystic ovarian syndrome, and unfortunately don't get much help from conventional endocrinologists or conventional gynecologists. And for younger women, like young teens, oftentimes get put on birth control, not even for birth control, but for trying to regulate their hormones and their cycles. And we're going to talk more in detail about why that may not be such a good idea, at least just blindly prescribing birth control like that, and what we can do to be more specific and try to be more accurate with helping people. All right, here we go. And feel free to post any questions you might have in the chat. I'll try to get to any questions towards the end of the webinar. All right, quick disclaimer. All this information is not intended to treat or diagnose. It's mostly just for informative purposes. Every case is unique and different. And so please consult with your own personal healthcare provider or come see us, schedule a consultation with us, and we can work one-on-one with you and help guide you. All right. A quick housekeeping reference here. Karazian Institute is a place where I do a lot of my functional medicine training. I just want to make sure I use some of the slides in my previous lectures that I've taken. Just want to make sure credit is given where credit is due. Any other medical providers interested in learning more into functional medicine, the Karazian Institute is a great place to go. All right, so brief overview. We're going to talk, so there's a lot of areas to talk about in female hormone health. I realize we can have some women interested more in menopause and perimenopause, some women interested in fertility, some women interested in getting off birth control or repairing damage post-birth control. And so I'm going to speak in very general terms, but like I said, if you want to post a question in the chat box, I can try to answer specific questions. Otherwise, I'm going to provide a general overview of hormone health and hormone balance. And we can start with here fertility. And let me put my silencer on here. Give me 1 second. All right. Silence on. All right. And fertility. And if we look at 8 steps to healthy pregnancy and recovery, step 1 has to be normalization of menstrual cycles. And that is step 1 because most of the time, infertility issues happen because of irregular cycles or lack of cycles. And so you can see step 1 is really where we're going to focus a lot of our talk, because this happens typically early in life, so early teens, the beginning of menstrual cycles, and tend to just worsen as time goes on, right? Even the WHO has listed here top causes of infertility and ovulatory disorders, meaning irregular cycles, is the leading cause. And then, of course, 40% of cases are due to the male partner and poor sperm production or poor sperm health. And I honestly think the male factor is growing exponentially fast. It may even overtake ovulatory disorders in women as leading cause of infertility. And we'll talk a little bit more about why that is. So symptoms of an abnormal menstrual cycle. So getting away from infertility for a second, if we talk just about menstrual cycles for women, what are some of the common symptoms? What do you think of abnormal menstrual cycles? Right. A lot of them are going to be your classic, what's considered classic PMS symptoms. It could be moderate to severe pain and cramping. It could be irregular cycles, prolonged cycles. It could be extremely heavy bleeding cycles, or many days of bleeding in your cycle. It can be hormonal acne. It can be severe mood swings like depression, anxiety. It can be hormonal migraines as well. The list is pretty big on classic abnormal menstrual cycles symptoms. And so what do you think is the conventional approach to trying to normalize menstrual cycles? And I kind of hinted at this already at the very beginning in my opening slide, but typically it is birth control, right? And that tends to be the go-to for gynecologists, even primary care doctors. For example, let's say you're a parent and you take your teenager who suffers with really, really bad pain and cramping, heavy bleeding to the point where they're becoming anemic. And so they have a lot of fatigue and brain fog symptoms. And the doctor says, well, let's put you on birth control to regulate out your cycle. Well, all they're doing is blindly putting more hormones into a system that's already dysfunctional and imbalanced with hormones. And there's no testing, no specificity to it. And so my next question, how are hormones often tested? Well, oftentimes they're not tested. And we'll get into a little bit more detail into that. But especially as a teenager or young adult, you're almost never getting your hormones tested because at this point, hormone irregularities or menstrual irregularities are so common that I think the conventional medical approach is just not even test and just medicate with birth control. And I want to educate you on how that's not the best way to go, and you can easily find other routes to improve this without medication. Okay. Now, if birth control is being used to prevent births, and that's another story. But young teens who are not sexually active but are trying to regulate PMS or hormone-related symptoms, birth control can sometimes make symptoms exponentially worse. So how does a female hormone cycle work? First of all, well, all hormone activation begins in the brain first. The brain sends out a signal to the ovaries to produce either estrogen or progesterone, and that signal is through FSH and LH, which gets released from the brain. When the brain releases FSH and LH, assuming the ovaries receive that signal, the ovaries then get activated and turn on either estrogen, produce estrogen, or they produce progesterone at certain times of the month of your cycle. Now, in the case of menopause or perimenopause, what happens is the brain continues to send out a signal of FSH and LH to the ovaries, but the ovaries are no longer responding. And these initial phases of no longer responding is often your perimenopausal symptoms, which may be irregular. For example, you may go a few months with no period and then have a cycle all of a sudden. And then you'll go another few months with no period and then have a cycle all of a sudden. It may be the beginning of hot flashes, the mood swings, trouble sleeping like insomnia. And so when that starts to happen and the ovaries start to fail, the adrenal glands work to pick up some of the slack, and they do produce a small amount of estrogen and progesterone. Nowhere near the same amount that the ovaries do, but having healthy adrenal glands is very important for this perimenopausal transition into menopause. Now, we don't have time to go into depth about the adrenal glands. I did speak a lot about adrenal gland function in my Balancing Blood Sugar and Preventing Diabetes webinar, because if you did watch that webinar, you remember the adrenal glands have a couple functions. Aside from producing estrogen and progesterone, the adrenal glands release cortisol, and they also release adrenaline in the form of epinephrine and norepinephrine. And cortisol gets released in excess with inflammation and with infections. And adrenaline gets released when we underconsume calories or underconsume protein. And so when we work at healing the adrenal glands, or if we're concerned about adrenal fatigue and adrenal stress, one of the primary ways I work with patients to try to heal the adrenal glands is through making sure they're eating enough calories, they're not over-exercising or overtraining, and that they're consuming enough protein per day to minimize the release of excess adrenaline and cortisol into the bloodstream. All right. So if someone, you can imagine a woman in your late 40s, turning 50, has had a very stressful life, maybe has a very stressful job, always forgets to eat because she's dedicated to the kids or to the home or to her job or all at the same time, and has continually functioned in a depleted state, surviving on essentially caffeine and adrenaline. When she does start to go through perimenopause and menopause, she's going to have a very hard time because those adrenal glands have been working in overdrive for many, many, many years. All right, so how does the female hormone cycle work, right? Continued. So like I mentioned, adrenal glands are very important for producing estrogen and progesterone. And testosterone is also very important. Now, all women produce a baseline amount of testosterone. However, women are estrogen dominant and men are testosterone dominant. But women can become testosterone dominant, or better said, overproduce testosterone, and men can become estrogen dominant and overproduce estrogen. Testosterone and estrogen are made, what I should say is estrogen is made from testosterone. And so we can flip production of that depending on our diet and our lifestyle. And for women specifically, high testosterone causes PCOS, or polycystic ovarian syndrome. Polycystic ovarian syndrome causes ovulation disorders, menstrual cycle irregularities, causes the formation of cysts to develop on the ovaries, and disrupts the signaling from the brain to the ovaries to produce the appropriate amounts of estrogen and progesterone. That's why PCOS can often cause lack of menstrual cycles. So that is a woman who has become testosterone dominant. And I spoke a lot about this in my blood sugar webinar, because the primary cause of high testosterone in women is high levels of insulin and high levels of blood sugar, meaning overconsumption of calories and or overconsumption of sugar and carbohydrates. Now, for men can become estrogen dominant and overconvert all their testosterone into estrogen, basically through the same way. Having high levels of insulin, high levels of blood sugar, having a high caloric diet, and over-consuming sugars and carbs. And so for men, typically they'll start to grow, they'll put the weight on around their belly. So they'll have a really big belly, but maybe skinny legs and skinny arms. They start to develop excess breast or chest tissue. and they may become a lot more emotional and emotionally unstable. All right. For women, again, you get cyst development. You can grow facial hair, thick black hairs around the jawline, the chin, the neck, or start to lose hair. So women can develop the same male balding pattern when they're too high in testosterone. This is, in fact, one of the leading causes of hair loss and hair thinning in women, PCOS. All right. So this is how we can test hormones in the functional world. This is called an expanded female hormone panel. And what it is it's a saliva test. It's a saliva test where every 2 to 3 days you collect a sample and you store it in the freezer. And collection starts on day 1 of bleeding. You collect every 2 to 3 days. You keep the saliva samples in the freezer. And then your last collection is pretty much when you start the next month of bleeding for your cycle. You ship that to the lab, and the lab sends me this pretty awesome report. And it graphs out what your hormones, specifically what FSH, LH, estrogen, and progesterone are doing throughout your entire cycle. And you can see this is what an ideal perfect hormone balance should look like. The green line is estrogen. The red line is progesterone. The first half of your cycle is called the follicular phase. And the brain releases FSH to stimulate the production and the release of estrogen. So we get this nice estrogen spike. And then that triggers the release of LH from the brain to then trigger the release of progesterone. And that's our red spike here. Okay. In between the two spikes of hormones is ovulation. So this estrogen spike triggers the release of the egg from the ovary. As it travels down the fallopian tube, right? We got a couple days in here of ovulation. This is prime time for getting pregnant, fertility. And then we have the spike in progesterone. Progesterone predominantly provides nutrients to the uterine wall and prepares it for implantation. All right. A couple of things I want to point out here. If you notice estrogen at the very beginning, the baseline level of estrogen should end at almost the same baseline level. That means estrogen is being sufficiently increased and metabolized out and excreted largely through urine, so through the kidneys, but also through fecal matter, so through the liver, gallbladder, and the intestines. Okay. When we get insufficient metabolism of hormones, we start to get a buildup or a backup of hormones in the system, which can lead to irregularities in these hormone spikes of estrogen and progesterone, and then disruption of a normal menstrual cycle. Okay. Now, the reason this is never used in conventional medicine or gynecology is because they rely solely on blood testing. The problem with blood testing is that it only gives you a snapshot in time of what your hormones are doing. And so depending on where you are in your cycle, you'll get a snapshot of what hormones are doing. So let's take, for example, right here let's say, for example, on day 8, you get a blood test to measure your hormone levels. It's only going to tell us what your hormones are doing on day 8 of your cycle, right? It doesn't tell us what has happened the rest of the cycle length. We don't know if you're getting an efficient estrogen spike. We don't know when that estrogen spike is happening. We don't know if you're having a proper time of ovulation in between the estrogen and progesterone spikes. We don't know when proper ovulation is, right? There are test strips, urine test strips that help with that, but this gives us a more accurate guideline at least, of when to start looking at ovulation. It doesn't tell us if progesterone is spiking high enough. And it doesn't tell us if estrogen levels and progesterone levels are dropping back down to baseline, or if they're starting to back up into the system, causing excess levels of hormones. Okay, so that's the downfall of blood tests. The only way they could get a graph like this with blood testing would be to actually have you do a blood test, a blood draw every 2 to 3 days of your entire cycle, which ends up being very expensive, and no insurance is going to pay for that. So that becomes a challenge. So we use the saliva testing, and we can get these pretty cool graphs here, right? It gives us a lot of data points, so that we can specifically support your hormones as needed. Do we need to support estrogen? Do we need to support progesterone? Do we need to support the brain's release of FSH and LH? Or do we need to support your body's detoxification capacity to metabolize and excrete out the hormones you're producing? All right. Now, the downfall of this test is that it cannot really be used if you don't have a cycle, right? Because we don't know when day one is, so we don't know when to start measuring. We also cannot use this if you're already on birth control, right? And this becomes the big challenge when we get a young teen, their parent brings them in. Birth control is causing more side effects than it is helping. We need to work at balancing their hormones, but they've already been put on birth control, and we have to wait till they come off the birth control, let their system try to regulate out. Hopefully they start their menstrual cycles again soon after coming off the birth control. Then we can start measuring, right? So this becomes very frustrating. This approach should be the first line approach before just blindly prescribing birth control, because you can imagine some birth control pills are largely estrogen based, and if someone is having irregular cycles because they have too much estrogen or an estrogen backup in the system, and then you put more estrogen into the system, you can expect that individual is going to experience a lot of side effects. That's also true of progesterone, right? If an individual has high levels of progesterone already, and then they can put on a progesterone-based birth control, you can expect a lot of side effects to happen. On the flip side, if someone is naturally progesterone deficient and they get put on a progesterone-based birth control, they may do really well on that birth control. But again, your primary care doctors, your gynecologists, they don't know because they're not testing this. They're just blindly guessing. All right. So types of hormone imbalances, like I was just mentioning, estrogen dominance. So too much estrogen in the system. And oftentimes that's a backup of estrogen because it's not being metabolized and excreted through the liver, the gallbladder, through the kidneys, or through the gut microbiome. A progesterone deficiency, low estrogen production, brain pituitary failure, meaning the brain is just not sending out the FSH, LH signal. And that is a lot less common. That tends to be seen with concussions or traumatic brain injuries. That can dysregulate hormones via that pathway. And then the other possibility in here is autoimmunity, which I didn't add here, but autoimmune diseases can attack the ovaries. And what happens in this graph, if I scroll back up here, is that autoimmune conditions will affect the receptors on the ovaries, and the brain will send out the signal of FSH and LH, but the ovaries will no longer receive that signal. And that'll cause dysregulation of these hormones. One big potential cause of this autoimmune attack of the ovaries, especially in young people these days, is actually COVID and the COVID vaccine. There's been a lot of reports of women having really irregular or losing their cycles after the vaccine. even after the COVID infection itself. I had a case myself of a woman who she actually started having a menstrual cycle every 2 weeks. And this happened right after she got the first vaccine. And this went on for months and months and months. And we worked for a couple months to try to regulate her cycles back out. And we were able to do it. It took us some time to kind of detox her system out. But you can imagine how frustrating that is. Okay, so let's get back to where we left off. So these are different types of hormone imbalances that can exist. And again, if you're already this case where you have an estrogen dominance and you start taking the pill as birth control to try to regulate your hormones, well, now you're just adding more estrogen into an already estrogen dominant system, and you make symptoms worse. So this is what graphs would look like. I drew these out by hand, but these would be what they look like if we did a saliva panel. You can see here, green line is still estrogen. The red line is still progesterone. We don't get a return to baseline level of estrogen, right? So you can see where we started and then where we're ending. We're above baseline, so the body's not excreting out the hormones, the excess estrogen, and it's starting to build up in the system. We're even getting here, you can see a double estrogen spike. We're getting the first spike where it's supposed to happen, and then we're getting a secondary spike, and then just a buildup of estrogen over time. This excess estrogen causes a deficiency in progesterone production, right? Because progesterone release is highly dependent on a big and accurate estrogen spike, signaling to the brain to start to release LH and progesterone. This is an example of a progesterone deficiency, where we get a normal estrogen spike and comes back down to baseline, but progesterone, for whatever reason, is just not being produced in enough amounts. And this tends to be a presentation I see fairly often in women who have really bad menstrual cramping. There's a couple routes we can take. We can naturally support the release of LH from the brain with certain targeted vitamins and herbal supplements. We can support the body's production of progesterone through, again, natural herbal supplements and vitamins. B vitamins tend to play a big role in both the brain release as well as progesterone production. There are a variety of herbal products that are marketed as progesterone supporters. Certain types of berries, certain types of yam extracts, all can help progesterone production. And progesterone is available over the counter. You can find topical creams that have low amounts of progesterone, so they don't have to be prescription based. Most estrogen replacements are prescription based. But again, there are a number of natural vitamins and herbal products that can be used to help support production of these hormones. Here's an example of what a graph would look like for low estrogen production. So we get a small spike, but not a big enough spike to trigger a sufficient release of or activation of the brain and release of LH. And so what happens is, because we don't get a big enough spike, levels kind of teeter at a high level longer than they should. So we don't get a very accurate ovulation, or we may not even get an ovulation phase because we don't have the two extreme peaks of estrogen and progesterone. And then it slowly tailors back down to baseline. All right. So those are a few examples of what a saliva hormone test could tell us about your hormone imbalances. Here we have, all right, so the point is blindly prescribing birth control is not really the solution, right? Now, my opinion may be biased, but it seems like more often than not, women have an exacerbation of their symptoms, or at the very least, the birth control helps with their symptoms and their hormone imbalances. But what happens is, a few years later, maybe they want to come off the birth control, or they're looking to maybe start a family. Maybe they've gotten married. Maybe they want to have get pregnant and have a child. They come off the birth control, and all of their hormone imbalances that existed prior to starting the birth control are all still there. They all come back, and now they have to work at, again, trying to balance the hormones, or they end up going through IVF and fertility treatments to try to synthetically increase hormones for fertility. All right. So like I said here, underlying imbalances return. Types of birth control, I won't spend too much time on this, but this is something I feel like women and parents should be more educated on by gynecologists or primary care doctors. There are non-hormone based birth control, and the most popular one being a copper IUDs. Again, they don't secrete hormones, and copper works as a spermicide to kill sperm. Tends to work pretty well with minimal side effects from what I've seen. There are pill-based birth control that's largely estrogen. There's Depo shot, which is largely progesterone-based. And so there's a combination of any of these. But knowing what your baseline hormone levels look like could help make a more accurate diagnosis. All right, so let's keep going through here. Again, we had a couple of new people join in. If you have any questions, feel free to post them in the chat. All right. So what is the functional approach to balancing hormones? Well, number one, test and identify where the breakdown is. We just spoke about that through saliva testing, and then using diet, nutrition, and lifestyle to improve those hormone imbalances. Again, if we're talking about PCOS, which is polycystic ovarian syndrome, we're looking at likely high levels of insulin, high levels of blood sugar. We need to put you on a high protein diet. We need to minimize carbohydrates and sugars and make sure you're eating enough calories each day. If we're looking at BMI, so having too high of a body mass index or too low of a body mass index, so being underweight can be just as detrimental as being overweight. Again, we need to look at what does your diet look like, how many calories are you consuming, how much protein are you eating per day. All right. And if we're talking about a progesterone deficiency or an estrogen deficiency, we want to make sure it's not autoimmune based. And we want to look at what natural vitamins and herbal supplements can be used to improve the production of those hormones. All right. So just to review again, this is how hormones work. The brain releases a signal via FSH and LH. The ovaries receive that signal and are signaled to either produce estrogen or produce progesterone. In the case of perimenopause, menopause, the ovaries no longer receive that signal from the brain, and the adrenal glands have to pick up the slack. Right? And that's what a normal hormone profile should look like, or an ideal hormone profile should look like. Right? So what are other diet, nutrition, and lifestyle strategies we can implement? Well, omega-3 levels are super important. It helps deficiency in omega-3 levels can decrease hormone signaling and increases menstrual cramping. And so when we talk about omega-3 versus omega-6 ratios, that's something that can be ordered on a blood test, and I often do screen for that. However, because of the standard American diet the way it is and the overconsumption of processed seed oils and highly processed vegetable oils, most people are omega-6 dominant and deficient in omega-3. So this is another place where looking at diet and oils you use and cook with can make a big difference. But the easiest thing to do is to really just supplement in omega-3 high-dose fish oil. Proper detoxification is needed to excrete hormones and toxins. And remember, largely detoxification or metabolism and detoxification of hormones largely happens through the liver, the gallbladder, and through the gut, through the intestines, and it's excreted through bowel movements. So if you have an unhealthy gut, if you have symptoms of bloating, indigestion, reflux, constipation, diarrhea, tenderness after meals, any of those type of gut related symptoms, there's a breakdown in your gut health. And our next webinar is focused on gut health specifically. That's going to be on November 14th. Talk about IBS, reflux, bloating, and a few other things. But optimizing detoxification pathways is super important for making sure you don't have an excess buildup of hormones. And this is especially true for anyone on hormone replacement therapy and on birth control. Right? Like I mentioned before, having a high or low BMI increases inflammation and can dysregulate your cycles and trigger worse PMS symptoms, so worse cramping, and is also a big contributor to infertility and PCOS. And of course, that leads to overconsumption and underconsumption of calories, right? And for women, that causes too much testosterone production. For men, it causes too much estrogen production. And again, that leads to us, the way we would confirm this is we would test 3 different testosterone numbers in a blood test. We would look at DHEA levels, which is a testosterone precursor, and then we measure your fasting insulin and your fasting blood glucose levels to see if that is the case and if that is driving your PCOS symptoms. Now, I've worked with women who don't have a diagnosis of PCOS, but they have a lot of the symptoms. And when we check their fasting insulin numbers, they are through the roof. They are very high. And oftentimes their insulin will be high, but their blood sugar will still be normal, in the normal range. And what that means is that's an early warning sign that they're already having symptoms, but they can't be officially diagnosed with PCOS yet. But I was working with a case just last week. A woman came in and her primary concern was actually her hair was thinning and balding. And she couldn't figure out why. And then, of course, weight gain that she couldn't figure out, she couldn't lose. And her testosterone numbers were all normal. Her fasting blood sugar was normal, but her fasting insulin levels were sky high. And when we spoke about what her diet looked like, and I had her food journal, sure enough, she snacks a lot on chips and carbohydrate-rich foods, which is driving that high insulin levels. Eventually, if she continues, her testosterone levels will start to shoot up, and she'll start to develop cysts on the ovaries. Right? So if that's never checked, it's never addressed. And by the time you do have cysts develop on your ovaries, that's late stage symptomatology already. And it takes a lot longer to try to get out of that or reverse that damage. In fact, one of the primary way most gynecologists treat PCOS is they prescribe diabetes medication. So they prescribe metformin to try to deal with it, but never actually talk about how an individual needs to change their diet and exercise, track their calorie intake, and increase their protein. And then the last one here, extremely high stress and extreme exercise. So this is largely individuals who tend to overtrain or over-exercise. You essentially deplete your body. These individuals also tend to undereat. And so they're pretty much just working out to point of exhaustion too much. And that'll cause irregular cycles. That can lead to too much testosterone production and contribute to infertility issues as well as PCOS. Now, this last factor we're going to finish on is going to be endocrine disrupting chemicals. And these are chemicals that are found in our environment practically everywhere that bind to hormone receptors and completely disrupt normal balance. A lot of these chemicals can be found in personal care products. And so if we look at this is a study, this is just a snapshot of a study, and I want to blow this up for you here. All right. So I'm gonna point out the most prevalent ones. BPA. BPA is found in plastic water bottles, plastic toys, plastic Tupperware. You'll see a lot of plastic items be labeled BPA free. That does not mean it's any safer. That just means they switched the A for a different letter. So now they call it BPS. It's equally as toxic. It's just marketing that they can market it as BPA free. And these chemicals leach into our food. They get into our bloodstream, and you can see all the listed side effects here that were found in this study. For women, for men, reduced sperm concentration, motility, and form. For women, disrupted cycles, fewer follicles, miscarriages, shortened gestation, poor fertility treatment outcomes, PCOS, endometriosis, uterine fibroids, right? That's a lot just from plastic. And so one of the things we coach people through is getting rid of plastic Tupperware, get all glass, get non-toxic pans for cooking, because the non-stick lining of pans is essentially toxic plastic. The non-toxic ones don't have that, or use titanium, use steel, which everything tends to stick to those pans, but that's another story. Or just make sure you get ceramic or non-toxic, right? Phthalates. Phthalates are found in a lot of personal care products, lotions, creams, shampoos, and soaps. And you can see the listed side effects for women: fewer follicles, PCOS, shortened gestation, preterm births. Again, for men, reduced fertility and semen quality. Air pollution, there's not that much that can be done about that, but I want to skip all the way down to pesticides. Now, this is the other big one that's common in our environment almost everywhere. You can see disrupted cycles, miscarriage, preterm birth, PCOS, endometriosis, fibroids for women. For men, again, reduced sperm concentration, motility, and form. Okay. Now, pesticides, that goes to eating organic as often as possible, especially produce. That goes to not drinking tap water. So either buying natural spring water or having a reverse osmosis filter in your home, or buying from a water filtration place that uses reverse osmosis and carbon filtration to get these chemicals out of the drinking water. All right, this is becoming a huge problem, more and more prevalent everywhere. More and more studies and research is coming out on this, because a lot of runoff from farms is falling into water sources in the ground, contaminating those water sources. And they do not, as far as I know, they do not get efficiently filtered out in sanitation centers. Okay, medications don't either. So that's another, there was a huge report that came out not too long ago where they tested a bunch of water sources in different cities in the United States. And the most common ingredients they found were some toxic heavy metals, but largely medications, pesticide residue, and things like that. Okay. Now, again, maximizing or optimizing detoxification pathways helps decrease your internal load of these chemicals. But we also have to do as much as we can in our environment to control our exposure to it, right? It's very difficult, but there are little things that can be done. And A resource for you can be a website called ewg.org, which is the Environmental Working Group.org. So EWG. And there you can put in, they have a database where you can search all your personal care products, toothpaste, lotions, creams, and they rate these companies based off cleanliness and how many pollutants they use in their products. And so they'll give it a grade from A to F, and they'll tell you some of the toxic chemicals that are found in those products, and you can find alternatives, right? That's something very easy you can do to minimize exposure from personal care products, okay? This was a really awesome podcast from the Joe Rogan Experience, Dr. Shauna Swan, episode 1638. This woman is a epidemiologist, toxicologist who has been studying the effects of chemicals in our water on testosterone and sperm count in men. And she has been tracking this since, I think, the 60s or the 70s. And it's been a while since I listened to this podcast, but if I remember correctly, she stated that men's testosterone levels have declined by something like 70% since the 60s and 70s to now from these chemical pollutants in the water. And so, I mean, you can only imagine the repercussions that's going to have for future generations, not even just for fertility, but testosterone for men is so important for brain health, for heart disease prevention, for libido, for bone health, right? So many different aspects of health. I mean, I really recommend this podcast because it'll really hit home the importance of tracking these things. All right, so in summary, just to wrap up here, testing in the conventional medicine is rarely done and usually incomplete because it's often done with a blood test, and it's only a snapshot in time of what's happening throughout your entire cycle. Conventional treatment is birth control, which doesn't address the root cause. Birth control use can lead to post-birth control syndrome, meaning when you come off the birth control, for a small subset of women, they never regain their cycle. And I don't think that's talked about and warned about often enough before starting birth control. We must identify where the root cause of the imbalance is, and one of the best ways to do that is through this saliva testing of hormones throughout your entire cycle. But there are a few drawbacks from that testing. Again, if you don't have a cycle, we can't use that test. If you're already on birth control or hormone replacement, again, we can't really use that test. So those are the drawbacks. We can use blood testing and try to time specific days and times to do that blood draw. And then diet, nutrition, and lifestyle strategies are the most practical and healthy at addressing underlying causes of hormone imbalances. And again, if birth control does work at regulating your hormone symptoms, when you come off the birth control, there's a high probability all those imbalances and symptoms you had prior come back. All right. And then that's it. Book your free 30-minute consultations. If you are interested in having a free consult, you can text the words free consult to my office at 512-641-4500. Follow me on Instagram, social media. I post a lot. I can post additional questions, answers, if anybody does have additional questions. Let's see, I'll wrap up here. I'll take a couple, 2-3 minutes just to walk you through some cases that I've seen over the years. And again, if you do have questions, throw them in the chat box before we wrap up in the next 2-3 minutes. So I'll give you an example. See, last year I worked with a woman, 35 year old female. She came in, chief complaints of fatigue, low energy and brain fog. She went to a hormone specialty clinic, medical clinic. They measured her estrogen, progesterone, testosterone levels, and they concluded that she had some sort of hormone deficiency and that she would benefit from taking estrogen and progesterone. She did this for a year, and guess what? No change at all in her symptoms. That's when she found us. That's when she came to see me. I took a look at all her labs and I said, well, you never had a deficiency in the first place, especially for being 35 years old. It's not like she was in a perimenopausal state either. And what we found out in her blood test was she was not eating enough calories. She was under eating protein. And she was, her thyroid wasn't working so well. So we customized the nutrition program for her. We put her on some basic supplements. And in 6 weeks, all her symptoms were gone. She had lost weight and she had more energy than ever. And she pretty much took herself off the hormone replacement because she said, well, it didn't do anything anyways. If anything, it probably dysregulated further her hormones. And if you did get a chance to watch my thyroid webinar, one of the hidden causes of thyroid imbalances is actually hormone replacement therapy. And if I remember correctly, that's what was happening with her. Another example of, I had another case just last week. A woman comes in, 20 years old, just got off birth control. She's been on it since the age of 14. And she got put on it because she had very heavy bleeding. So her doctors recommended she start birth control for it. She tried the pill, didn't have very good results. She did the depot shot instead. And it did work at controlling her heavy bleeding because she pretty much wasn't having any cycles at all. But she put on like 30 pounds within the next 3-4 months. So again, controlled the issue, but caused some massive side effects. Now she's working with me because she wants to get off the birth control and try to regain her hormone balance and health and get that excess weight off. But the tricky part is it's been 3 or 4 months since she stopped the birth control, but she still has not started a cycle yet. So her system is still struggling to regulate its normal balance. So we're working on that case now. I'll give you another example. A couple of years ago, I had a woman, early 20s, suffered with pretty severe depression during her PMS time frame. So about, say, a week to 2 weeks before her period was to start, she would get very severe depression. She would just stay in bed crying, lots of sadness. And then once her period started, everything went back to normal. Well, she had a pretty massive hormone imbalance there. Her doctor tried to put her on birth control, and the birth control exacerbated her already imbalance, and so her depression got severely worse. Luckily, she recognized that right away, and she stopped the birth control right away. But you can see how just blindly prescribing birth control can make matters worse. All right, perfect. And I already explained the other example of the COVID vaccine and autoimmunity and how that can affect the ovaries. That was another case we had due to the vaccine. All right, well, thanks for joining, everybody. I don't have any questions listed here. Feel free to follow my Instagram, my TikTok. If you do have follow-up questions, you can post them there, and I'll make a special video for you on any specific questions you might have. All right, thanks for joining. Bye-bye.